heart and circulation, rhythm, control, and disease. Your heart doesn't just beat, it follows a rhythm. Precise, electrical, and automatic. It all starts with a tiny cluster of cells in the right atrium, called the sinoatrial node, or synode. This is the natural pacemaker of the heart. It sends out electrical impulses about once every second, telling the heart when to contract. The signal spreads through the atria, then down to the atrioventricular node, into the bundle of His, and finally through the Purkinje fibers, reaching the ventricles. The result, a perfectly timed heartbeat. Atria first, then ventricles. Push, push, pump, pump. Regulation of the circulation, but the heart doesn't work alone. The entire circulatory system is under constant regulation by the nervous system and hormones. When you're stressed or exercising, the sympathetic nervous system speeds up your heart and narrows blood vessels to raise blood pressure. When you rest, the parasympathetic system slows everything down. Meanwhile, sensors in your blood vessels monitor pressure and chemical levels. They send signals to the brainstem, which adjusts your heart rate, vessel width, and even how much fluid your kidneys retain, all to keep your blood flow stable. Investigating the heart and blood vessels when something feels wrong. Chest pain, shortness of breath, fatigue. We turn to diagnostics. Doctors use a range of tools, blood pressure measurements, electrocardiograms, to trace the heart's electrical, rhythm echocardiograms, to see the heart's structure and motion, blood tests to check for heart enzymes or cholesterol, CT scans, and angiography to view blood vessels and blockages. These tools help us detect disease early, before it becomes life-threatening. Cardiovascular diseases. So what can go wrong? The most common conditions include hypertension, high blood pressure that strains the arteries, and heart atherosclerosis, the buildup of fatty plaques in arteries, reducing blood flow, heart failure. When the heart can't pump enough blood to meet the body's needs, arrhythmias, irregular heartbeats caused by faulty electrical signals, myocardial infarction, a heart attack, when blood flow to the heart muscle is blocked, stroke, often caused by a clot or burst blood vessel in the brain. Linked to vascular health, these diseases are often linked to lifestyle. Poor diet, smoking, stress, lack of movement, and genetics all play a role. Final thought: your heart and blood vessels form a complex, self-regulating system. It adapts every second of your life, until something throws it off balance. Understanding how it works, and how we investigate it, is the first step to preventing disease and staying alive.